Hi everybody, this is Janet D, the PT. As a licensed physical therapist, I'm going to talk today about what diabetics should know before surgery. Okay, so when you're getting ready for surgery, whether or not you have anesthesia with your procedure, okay, your stress levels, and your blood sugar going into the procedure is going to affect how your body responds after the procedure. Okay, so being really proactive and being healthy and active before your surgery really helps you on the back end. Okay, so what happens after surgery? Okay, so you go into surgery and your blood sugar levels are going to be thrown off. Okay, and that's because your body is going into that fight or flight mode. And so the insulin is not as regulated. And then your body is going to have these high blood sugar levels, aka hyperglycemia. Okay, so what are some of the risk factors of hyperglycemia post surgery? Okay, so some things can be like a chest infection, like pneumonia, a urinary tract infection, sepsis. You could have a stroke, heart attack, impaired or slow wound healing. Okay, that just happens because your body is trying to regulate this blood sugar in a state of chaos. Okay, so this is why it's so important to try to control your blood sugar going into surgery. Okay, and why it's so important after surgery to really take care of yourself. Okay, and being proactive in your health. So what are some of the signs and symptoms of hyperglycemia that you might experience post-surgery? Okay, they include frequent urination, thirst, increased thirst, blurry vision, fatigue, and nausea. Okay, so always let your doctor and nurse know how you're feeling. Okay, so then that way they can alter your blood sugar through medication in order to help get you over that hump. And being very active and participating with your physical therapy and rehab, again, is really going to help yourself get over this surgical hump. Okay, so what happens if hyperglycemia happens for several days and is not being in check? Okay, what are some of the signs and symptoms of that? Okay, so you can get that fruity breath, nausea, vomiting, shortness of breath, dry mouth, weakness, confusion. You could even have abdominal pain or a coma. Okay, and so this is why being aware of how your body is acting, trying to be as proactive in your health pre and post surgery is what's really going to help kind of maintain those blood sugar levels with surgery. Okay, so if these blood sugar levels aren't in check, what are some of the things that can affect us down the line? So cardiovascular disease, kidney disease, peripheral neuropathy. You could have wounds on your feet or skin damage. Okay, cataracts, diabetic retinopathy, bone and joint, teeth and gum problems are also another indication of uncontrolled diabetes or hyperglycemia over a long period of time. Can even show in your mouth. Okay, so this is why it is so paramount to be proactive in your health. Okay, so I'm just going to say the same things that I know your doctor says to you, your nurse says to you, your physical therapist says to you. Guess what? Get active. Stay active. Take your medication regularly. Okay, keep track of what your blood sugar levels are, pre and post each meal, and being more aware of what you are taking in for your nutrition. Okay, so reaching out to a dietitian, a physical therapist, a doctor, nurse, reaching out to these healthcare professionals to really be on your team. Okay, we're really here to help support you in your health journey, and we're all for making it easier and smoother than what it has to be. Okay, and just making sure that letting your doctor know if there's any like changes that you feel. Okay, because that is ultimately paramount. Is if something doesn't feel right, say something. Say something, okay? Because we don't know if you don't say it. All right. If you really like this video, go ahead and press like, share, subscribe, tell your friends and neighbors. Janet T, the PT.